Welcome, everyone. I'd like to welcome you to the Positive Choices webinar series. Before I move on, I would like to do an acknowledgement of the country. We are all coming together from different parts of the country today. So I would like to begin by acknowledging the traditional custodians of country throughout Australia and their connections to land, water, and community. I am currently on the land of the Dharawal people and pay my respects to elders past, present, and emerging. I further acknowledge the traditional owners of the land on which you are and pay my respects to the elders past, present, and emerging. I would also like to acknowledge the Aboriginal and Torres Strait Islander people joining us for the webinar today. My name is Smriti Nepal and I'm the project manager on Positive Choices. We have with us Dr. Erin Kelly today, who is going to be talking about Preventure, which is a brief personality targeted intervention to improve well-being and reduce behavioral problems in secondary school students. Dr. Kelly is a research fellow at the Matilda Center for Research in Mental Health and Substance Use based at the University of Sydney, and she is also a practicing clinical psychologist. Before we move on, a little bit of housekeeping. So I would like to tell you that you are on listen-only mode, which means that we cannot see you or hear you. This webinar is being recorded and will be made available on the Positive Choices portal within the next 48 hours. We have a question and answer session at the end of the webinar, so please type your questions using the comment box in your portal. What is Positive Choices? So Positive Choices is a portal that was developed by the Matilda Center and the National Drug and Research Institute in consultation with teachers, parents, and students. It is funded by the Australian Government Department of Health. It is a central access point for trustworthy, up-to-date drug and alcohol information and drug and alcohol educational resources. We have learning resources, fact sheets, videos, and games, as well as other resources to engage young people with drug education. We also provide access to evidence-based classroom drug prevention programs that have been shown to be effective in a classroom setting. In accordance with that, Preventure is such a program which we would like you all to be familiar with, and that is what Dr. Kelly is going to be talking to us about. Over to you, Dr. Kelly.
Thank you, Smriti. I'll just pop up my slides. Is that working?
Yes.
Okay, so as Smriti said, thank you. Hello, everyone. As Smriti said, I'm going to be talking about the Preventure program. So I'll just give you a broad overview of what's involved in the program and its evidence base. So to start with, I'm going to talk about mental health among adolescents in Australia and some ideas for what we can do about it. So mental disorders such as anxiety disorders, depressive disorders, and substance use disorders are a leading cause of disability for young people worldwide and a major cause of death in young people through suicide. Mental disorders have a broad array of impacts for adolescents, such as impacting on their learning and development, their peer relationships, and functioning in their families. Early onset of mental disorders leads to more chronic mental and physical health problems over the lifetime. So what are the rates in Australia? So according to the second survey of mental health of children and adolescents, 1 in 5 adolescents report high or very high levels of psychological distress.
Sorry, Dr. Kelly, we can't see your slides. You might need to go on slide share.
Sorry.
Yes, that's good. Thank you. Yes. Yeah, we can see it now.
No worries. Okay. So 1 in 5 adolescents report high or very high levels of psychological distress, and more than 1 in 10 have a 12-month prevalence of any mental disorder, and that's as reported by parents or carers, and slightly higher prevalence in male adolescents than female. The highest rates were for anxiety disorders, followed by ADHD, major depressive disorder, and conduct disorder. And that prevalence does differ by sex. So there's more internalizing disorders like anxiety and depression are a bit higher in females, and more of the externalizing disorders, ADHD and conduct disorder, tend to be higher among male adolescents. Interesting, when reported themselves, 8% of adolescents reported major depressive disorder. So that's compared to 5% as by parents and carers. And many of those adolescents reported that their parent or carer knew only a little or not at all about how they were feeling. So this really important highlights the importance of schools and also peers in mental health. Looking at the impact of mental disorders on educational outcomes, it's been shown that students with mental disorders actually had poorer NAPLAN results in Australia. So students with mental disorders scored lower than students with no mental disorder in every test domain and year level. The gaps in achievement increased over time, so that by year 9, students with a mental disorder were 1.5 to 2.8 years behind students with no mental disorder. And for students with ADHD or conduct disorder, they were up to 5 years behind. Students with mental disorders also had more absences from school. So across year 7 to 12, students with a mental disorder missed 23.8 days per year, compared to 11 for those without a mental disorder. Students with mental disorders also had lower levels of connectedness to school and engagement with schoolwork. Moving on to substance use, we can also see that quite a minority of young people in Australia do report substance use, with the most commonly used types alcohol and cannabis. We know with substance use that teenagers tend to start during that adolescent period, or people tend to start during that adolescent period, and then the typical onset of a substance use disorder by age 19. There is some good news, however, with evidence that young people are delaying their onset of drinking. So when in about 1998, the average age of onset for drinking in Australia was 14.4 years, but in the last survey to 2016, it increased to 16.1 years. While there hasn't been a drop in illicit drug use, the rates are fairly stable, have been stable for a while. So in 2016, about 16% of 14 to 19-year-olds reported that they had used an illicit substance in the past 12 months. But back to the bad news. Unfortunately, still quite a lot of young people in Australia are drinking at risky levels. So in terms of reporting 11 or more drinks, 6% reported of 14 to 9-year-olds reported 11 or more drinks. And amongst the 18 to 24-year-olds, this was 15%. These rates of very high risk binge drinking remain significant and are highest among young people. Young people are also much more likely to be victims of alcohol-related crime. These findings are similar across Europe and North America, that while drinking has reduced overall, there's still quite a significant minority of young people that are drinking at very harmful levels. We need to focus more on those young people. Why is it important to prevent substance use overall? You're probably not surprised to know that there's a really high burden of disease and social cost associated with alcohol use. And that the earlier young people start drinking alcohol, the greater risk of an alcohol use disorder. It's more likely that they'll experience co-occurring mental health problems, they have worse academic performance, more likely to drop out of school, and can have substantial neuropsychological deficits. There is good evidence that for each year we can delay the onset of drinking, we reduce the odds of developing alcohol use disorder by 9%. So how can we do this? Since we know that the onset of substance use as well as mental disorders typically occurs during childhood and adolescence, this is also the period that young people tend to be in school. Unfortunately, most mental disorders remain undetected and untreated. Optimal intervention for substance use and other mental disorders should be timed prior to their onset, targeted to those at greatest risk, and be easily accessible to all in need. So, schools are the ideal setting to implement such programs. However, the delivery of targeted prevention programs for substance use and other mental disorders in school is limited, and few evidence-based programs are routinely used in schools. But there is a program that ticks all these boxes. Next, I'm going to talk to you about the Preventure program. So Preventure is an evidence-based prevention program that's feasible for delivery in schools and is targeted to adolescents with a greater risk of experiencing substance use problems and other mental health problems based on their personality traits. This is the group that we're really wanting to target in prevention. The Preventure program was developed by Professor Conrod at the University of Montreal and has been adapted for use in multiple countries. It's typically delivered to 13 to 14-year-olds, which is just prior to the age of onset for substance use and many mental disorders. It aims to increase coping skills, to prevent substance use and improve wellbeing. Preventure targets 4 personality types that have been linked to adolescent substance use and mental health problems. The one is negative thinking. So that's for people that are prone to low mood and they typically have negative beliefs about themselves, others, and the future. Next is anxiety sensitivities. This is more specific than just being prone to anxiety. It's a particular fear of the anxiety-related physical sensations. For example, you might be fearful of increased heart rate. Impulsivity is rapid decision-making and action. So they have poor response inhibition. It's hard to control their behaviours. And then sensation seeking, these are people that have an elevated need for stimulation. They can be very prone to boredom and tend to have increased rates of risk taking. The personality types relate to substance use in particular ways. So those high in negative thinking tend to start drinking earlier. When they do drink, they tend to drink more heavily. And they tend to drink in order to try and cope with their low mood. They tend to drink later than others, but once they do drink, they can drink at more problematic levels, which can be related to that, that they're more responsive to the anxiety-reducing effects of alcohol. So they get a very rewarding drop in their anxiety, which reinforces ongoing drinking. Both those with sensation seeking and impulsivity tend to start drinking earlier, more likely to binge drink or drink in more problematic ways. Those with high sensation seeking are more likely to experience alcohol-related harms, and they tend to drink due to enhancement effects. They enjoy that feeling from alcohol and having fun drinking, so they want to have more and more and more of that. On the other hand, those high in impulsivity drink due to poor response inhibition. If it's around, they'll do it. They have a harder time kind of controlling those impulses. These personality types also relate to other emotional and behavioural problems in addition to substance use. So you're probably not surprised to hear that those high in negative thinking are increased chances of experiencing later depression and more general emotional problems. That's as measured on the Strengths and Difficulties questionnaire. Similarly, higher emotional problems for those with anxiety sensitivity, and then specifically they're at greater risk of later having panic-related disorders. Those high in sensation seeking and impulsivity are both more likely to have antisocial and risk-taking behaviour. So it should be noted that these personality types just increase the chances of these problems either concurrently or later. It doesn't mean that these problems are definitely going to occur, just that the odds are greater for the young people that screen high in these traits. So what does the Preventure program involve? So basically, you start by screening all of the adolescents with a scale called the Substance Use Risk Profile Scale, or the SERPS, which has 23 items that measures those 4 personality dimensions. It's a really interesting scale, and then it's measuring as personality types, not substance use. So it's actually very broad and can look at anyone that's high in those personality types, and they're at higher chance of substance use as well as those other mental health problems. Previous studies of the SERPs have demonstrated that it's reliable and it's valid in predicting both substance use and emotional problems, and it has high cross-cultural validity. It's been used across Europe, Asia, North America and Australia, been translated in several different languages. So once you've screened the students, those that score highly in one of the 4 personality types, so it's 1 standard deviation above the mean for one of those personality types, get invited to take part in the program. The program includes 2 90-minute coping skills workshops, preferably run 1 week apart, so they've got time to practice in between. And these workshops are focused on their personality, not substance use. So they learn what their personality is like, how they're likely to kind of think about things, the emotions they'll feel, the physical sensations, what kind of behaviours they might engage in. And one of the things that they look at is the risky ways of coping with that particular personality type. And that's where substance use comes in, that it might be one risky way of coping with their personality type, but other risky ways are discussed too, such as withdrawing from their peers. So the interventions are based on evidence-based treatments, so motivational interviewing and cognitive behavioural therapy. So basically the students make goals that they want to achieve for the future. They go through exercises to learn about the pros and cons of their behaviour. They learn about CBT, so that our thoughts are really important in our behaviours, and there's lots of different ways to think about a situation. Our first thought is not necessarily always true. And then they learn how they could actually challenge some unhelpful ways of thinking that are related to their particular personality type. The program is delivered by trained facilitators and co-facilitators. So this could be a school counsellor or psychologist, youth worker, other health professionals interested in the program. To take part, if you're already a counsellor, it's a 2-day program. If you haven't got any counselling background, you do 3 days, so including a day of general counselling skills, as well as a day learning all about Preventure, personality types and the evidence base for Preventure. And there's a 3rd day where you review the specific components of the Prevention programs. You learn the CBT and the motivational interviewing, and you have some practice with role plays. If you want to be a high fidelity trainer, so that's the level that we use in research trials. I was trained by Professor Conrod as a high fidelity trainer, and as part of that you get supervision. So you conduct the program with some students once you've done your training. Then it's observed by a trainer, and then you get sort of checked out as a high fidelity trainer if you meet all the key criteria for the program. So now you know a bit about what the Preventure program involves. Let's have a talk about its effectiveness. So this is an overview of 8 randomized controlled trials examining the effectiveness of Preventure around the world. Overall, Preventure has a moderate effect size for reducing or preventing alcohol use and other mental health problems, which is a pretty strong effect for prevention programs. Basically, those students that undertake or that are in Preventure schools have about 30 to 50% less alcohol use than students that are in control schools. And by control schools, I mean schools that undertake their usual drug and alcohol education. You can see down there next to the star, that's the study that we did in Australia. And we found that the effects of Preventure still held after 3 years, which is pretty impressive for 2 90-minute sessions. So I'll go into a little bit more detail about the Preventure program. So as I mentioned earlier, the program was developed in Canada. So before undertaking a trial in Australia, the team adapted it for Australian students as recommended by Professor Conrod. So to do this, focus groups were undertaken with both students and teachers and health professionals. So the students that scored highly in one of the 4 personality types were asked to look through the manuals and give their feedback, as well as provide examples of scenarios that they might be likely to drink or when they've been high in that particular personality type. And we use those examples to update the manuals and make them really specific to Australian adolescents. We also updated the language in line with what the students recommended, changed the names and the look of the images so that it felt very, very relevant to them. We asked the teachers and health professionals what they thought of the program. Overall, they thought it was very appropriate in terms of learning, educational content, student acceptability, efficacy. They thought the content would be very useful for their students. However, they did recommend that the manuals be updated and made more relevant for Australian adolescents, so in line with what the young people suggested as well. So that was done. We made all those changes and updated it to make it relevant for Australian young people. Then we undertook a randomized controlled trial. So about half the schools were in the control group where they did their usual drug education, and the other half were allocated to Preventure. All students in both schools filled out the SERPs, which screened in about 40% of students into one of the 4 personality types, so roughly 10% in each of those 4. But only those students that screened in the Preventure schools were provided with the Preventure program. They were followed up regularly over the 3-year period, groups after, and then 12, 24 months and 36 months after the survey, from about age 13 average at baseline up to age 16 at follow-up. And there's actually now they've been followed up for 6 or 7 years, and we'll be getting results from that long-term outcome soon. So overall, over the 3 years, it was found that relative to students in the control schools, students in the Preventure schools reported significantly less alcohol use, so including less uptake of alcohol. Then among those that were drinking, they had lower rates of binge drinking and less alcohol-related harms. In addition, relative to students in control schools, students in Preventure schools reported significantly less emotional and behavioural issues, including psychological distress, anxiety symptoms, depressive symptoms, conduct problems, and hyperactivity. In addition to the effectiveness, students tended to report that they found it really useful as well. So these are some of our student comments. What did you like about the sessions? One young person said, "It opens up a part of our personality we were unaware of." Another, "It helped us to reflect on who we are and what we aim for. We got to understand what anxiety is and how to get rid of the feelings. It helped me identify and challenge my thoughts and feelings." Although with any program, there was also some things I didn't like about it. For example, one young person said it can be uncomfortable talking about personal stories. Another said not enough time, maybe needed more sessions, a bit rushed. Unfortunately, some schools we only had a 60-minute period to try and squish the sessions in, so I can agree sometimes it was quite rushed trying to get through it all. Another person said it takes up lesson time, perhaps lunch. So there was kind of some students that didn't want to miss out on class, but also some students reported that a benefit of the Preventure program was that they got to miss out on the class. So I guess we couldn't please everyone. I actually looked as well at whether Preventure might be helpful for bullying. So I'd found that that those particular personality types were also related to being involved in bullying, either being a victim and or a perpetrator of bullying. So it made sense to me that maybe the Prevention program could then be helpful for them. So amongst those that reported bullying victimization at baseline, those in the Preventure schools reported reduced victimization rates, suicidal ideation, emotional symptoms, and conduct problems compared to those in the control schools. There weren't that many bullies to look at, so I couldn't really look at the rates of bullying perpetration. So it's hard to know if it reduced bullying perpetration or not, but amongst those that did report bullying at baseline, the ones in Prevention schools reported significantly less conduct problems over time, and for female students there was less suicidal ideation over time. So promising results that Prevention could also be really helpful for reducing bullying victimization and for reducing those associated problems amongst those involved in bullying. So these were very exciting results for us. It was the first study in Australia to support the long-term effectiveness and Prevention in both alcohol use as well as mental health problems, and some evidence for other behavioural problems such as bullying. These results were consistent with trials in the UK and Canada. However, we wanted to see whether we could make the Prevention program more accessible for schools in Australia. So we went into schools as external psychologists coming into schools, but we wanted to be able to make it something that schools could run themselves. There's a study in the UK which showed that when Prevention was delivered by teachers in the school, the results were quite equivalent to external clinical psychologists coming into schools. So this led us to design the school-led Preventure study. So we wanted to examine the effectiveness of Preventure, alcohol use, depression and anxiety symptoms when delivered by school staff in Australia. This is really important because it would enable the broad reach of Preventure across schools at a lower cost. In addition to the main outcomes of anxiety, depression and alcohol use, we're also interested in whether the Prevention program might have broader outcomes. So we're looking at some school factors such as school engagement, attendance and grades to see if those undertaking Prevention improve in those areas. Broadening out the outcomes from bullying to more general peer and family relationships. Interested in whether Prevention improves quality of life and self-compassion. And then in light of everything that's been happening in 2019-20, we also added in climate change anxiety as a measure, and we're interested in whether it will help people cope with all of the distress and change around COVID-19. We'll be following students up over a 1-year period. We have started recruitment for this program now, so if you are based at a school in the Greater Sydney area or Wollongong and would like to take part in the trial, there is still time, so feel free to contact me. I'll share my contact details at the end of the presentation. Basically what the study would include for you would be the school would either be randomized to control or Preventure. Control undertake a baseline and 2 follow-up surveys. The intervention schools, in addition, have up to 4 staff that get trained in the Preventure program free of charge and get the supervision as well. Then they'll deliver the program at schools. The control schools don't miss out on the program, they just wait till the end of the follow-up period. Then they'll also be given free training and supervision as well as all the study prevention materials for the delivery. There's also more general training in Preventure that's offered. So health and school youth workers, other professionals are welcome to undertake training. We offer the training about 3 times per year in Australia. It's also run regularly in North America through the University of Montreal team. If you're in Australia, you can sign up to our mailing list on the Positive Choices website, or email Lucy, so Lucinda Grummet, the email address there to get more information. We're also hoping to have online delivery coming soon to Australia. So the Preventure Montreal team are finalising the processes at the moment. So this is both that you can get trained via Zoom, but also that you could then deliver the program to young people via Zoom. So this was something that the team wanted to do for a long time, but obviously with COVID, this pushed things along. So that will be available shortly. There's also lots of new projects happening internationally. So if you'd like to check out more of those, the Preventure Lab website there lists all of the ongoing projects. For example, the CUSP program, it's the Canadian Underage Substance Use Prevention Trial, which is really focusing on the outcomes for illicit drug use, including non-prescription opioid use, because that's a huge problem internationally, but in Canada. There's the Preventure study, which is looking at adapting Preventure for children in child welfare services. Neuroventure, which is looking at the impact of Preventure on the brain and seeing if they can really get a lot of detail on neurodevelopment and the aspects there. And Interventure, which is adding a little bit extra to Preventure, so the young people that are still experiencing problems get one-on-one support, and there's also parent training. So a lot is happening. I would like to thank the whole of the research team involved in all aspects of the Preventure training, as well as the Preventure research, and Professor Conrod and her team at the University of Montreal. I would like to thank all of the various funders that we've had for Preventure. If you would like more information, as I said, you can access information on what we're doing in Australia through the Positive Choices website. And for the information internationally, you can look at the Conrod Venture Lab website, as well as the Preventure Canada website more for the training. Also welcome to email me directly. If you're a school wanting to take part in the trial, you can email me, or if you'd like to ask any questions about the Preventure program or to undertake the general training of Preventure, please let me know. But I'm also happy to answer questions now if anyone has any questions.
Thank you, Dr. Kelly. That was such an interesting presentation, and I think it's going to be a really useful program for schools and for students. So I would like to request our audience to add any questions that you might have into your question and answer panel at the bottom of your screen. And I would also like to apologize to our audience for any technical issues today. Please note that this webinar session is being recorded, and it will be made available on our Positive Choices website, along with the transcript from the webinar, as well as the slides from the webinar. So while we wait for the question and answer, Dr. Kelly, I thought I would start off with a couple of questions of my own. So my first question is, I was interested to know whether you think, why you think the effects of Preventure program are so broad?
Thank you. I think because it's about personality generally, it's not just looking at, you know, whether people are already using substances yet or already have a mental health problem. It's just looking at their personality. So our personality impacts on, you know, all aspects of our life. So we're basically born with our temperament, and then that in interaction with our parenting and our early experiences starts to, creates our personality type. So that's our general way of thinking about things ourselves, our way of interacting with others, impacts on our relationships. So it's a really, who we are is going to impact on so many different outcomes. So that's why it makes sense to me that Preventure could help with school engagement, that it could help with general quality of life, it could help relationships, because personality is just so broad.
Thank you. I will go to audience questions now. The first question is, has this program been run in any department schools in New South Wales?
Yes, thank you. We're not allowed to say which schools have taken part in the program, but definitely in the CAP study that I went through, we had both public schools and private independent Catholic schools. There's also been people trained in the program from department schools, and for the school-led Preventure program, we have serif ethics, so we can basically recruit from all government schools in Sydney and Wollongong, and we also can, have ethics to recruit people from private or independent schools, and we're currently trying to finalise the ethics for Catholic schools in those areas as well.
Okay. The next question is, did the Australian efficacy study include students from rural and remote locations?
Unfortunately not. That one was based in Sydney, so it was only students in the Sydney area. It's a very strong interest of mine, so one day I would like to be able to update our Australian manuals to make it more relevant for young people in rural and remote areas. And by that I mean the scenarios and the images. The content itself stays the same. It has been shown to be effective amongst many different countries and cultures, but to make it acceptable to people in different areas, the images and the scenarios are changed. So rather than having a picture of the Sydney Opera House, we would have pictures of things from other areas.
The next question is, I noticed it only starts in year 8. The audience member wants to know, why doesn't it start in year 7?
Yeah, good question. It can do. It's kind of almost a sweet spot between their sort of cognitive development, that they're able to take on the concepts, and then early enough before most young people start using alcohol, or before the onset of most typical disorders. It can be run in year 7. Then maybe just would need a little bit help understanding the content sometimes, but it's just been found over time that year 8 tended to be the best balance of all of those factors.
This next question may not directly be relevant to Preventure, but I still think it's important to answer this. So I just wonder if you would have some thoughts on this. So the audience member says, my son is 16 and already has a drug and alcohol addiction, has talked about suicide, misses many days at school, grades are low. From trying to support him, I believe that these youths fall through the gaps and no support systems to turn to. They're wondering if you have any suggestion for students like him.
Great point. Because we do know that's the case, that often it can take people years before they actually access treatment. That's one reason that prevention is very important. Of course, not all people are going to go on to use alcohol or other drugs or have mental health problems, but if you can get good prevention earlier, it's going to reduce the numbers. Then at the next level, it's really helpful to have screening and early intervention before the problems really kind of take on, but still obviously have really good treatment available for people further along down the track, maybe like your son that can access help. This depends kind of on your particular area for treatment options for you, but often generally headspaces can be a good place that young people can access free and high quality health care. That young people might not see their GPs, but there's usually a GP within the health with the headspaces that they can access. There's lots of online programs available, so while young people might not feel comfortable going to seek treatment they might undertake their own online program, which I assume probably a lot are discussed on the Positive Choices website. Sorry, could you just repeat the last part of the question for me, Smriti? Make sure I've covered everything.
So they're saying that from trying to support him, they feel that these youth fall through the gaps and there's no support system for them. So they're just looking for suggestions from you.
Yeah, so hopefully the school could still be able to support him even if he's not attending very regularly, that it could be beneficial to connect with the school and see if they do have services to support him there. So in addition to what you could find on Positive Choices and Headspace and through a GP, hopefully he can get some support.
Yes, and to add to that, I would like to say that, yes, we definitely have a lot of resources for young people on Positive Choices, not just for young people, for parents who might need that kind of support. So if you need any support, any specific support, please make sure you email the team at Positive Choices as well. Okay, moving on to questions on Preventure. So could this be implemented into PDHPE?
Yeah, it actually ticks off all the criteria for the curriculum. So generally, say with the trial, it made sense for the Preventure program to be run at the same time as PE, so that people with without those personality traits would do the general drug and alcohol curriculum, and those with those personality traits would get kind of that extra help through the Preventure program, because it really does tick off the PE curriculum. So we think that is really beneficial for schools, and it could be a really useful kind of method moving forward, that we know that the normal drug and alcohol education is sufficient for most young people, but for those that will kind of have more difficulties, they would need or would benefit from more of a targeted approach like Preventure.
The next question is, can Preventure target cannabis use specifically?
Yes, one good thing about Preventure is that there's a whole range of different scenarios. So some of them do include cannabis and alcohol, but it could be, say, feeling low or having trouble with friends. So it's quite a broad focus. And that there's also sections where the young people can bring forward their own examples. And we have found positive effects of Preventure on cannabis use, both in Australia and internationally.
And the next question is this program only in the trial phase, or are the schools able to deliver the program right now?
Yeah, well, Preventure itself has been around for a long time, so I think close to 20 years. So it's definitely a evidence-based program that can be taken up by any schools. We do offer the general Preventure training, so you basically, if you want to deliver Preventure in your school, you undertake the training program, and then you purchase the manuals, which you can also see on our Positive Choices site, and run the program. And just if you happen to be in Sydney or Wollongong at the moment, rather than being offered that general training, we're holding off on training for the time being in those areas, but if you're eligible, you can take part in the trial, and then you actually receive the training and the student manuals for free.
The next question is, do you know when the online training platform will be available?
I believe in the next few weeks. So I've been in contact with the team at Montreal, and they said they're trialling it at the moment, making sure they can iron out any little glitches, and that hopefully it could be up and running by July. So I'm happy to keep people posted on that, or feel free to email me and check in. Previous trainees will be sent the links for the online the online delivery as well.
And I recall that you said that this is, you were calling out for schools in Greater Sydney and Wollongong area to participate in the trial. This is a question from a teacher based in the Central Coast. They want to know when this will be expanded to include schools in other areas.
Yeah. Email me. You might just fall into our catchment. Greater Sydney, we're kind of stretching quite broadly, so your school might already fit in, and if not, we can talk with you to arrange training for your area, and we'll be offering training probably later in the year, depending on how busy things are with the trial, if not next year.
Okay, don't have much time left for questions. Just one last question before we sign off. So, as the sessions are designed for small groups of select high-risk students, do you see any benefit to entire classes or cohorts participating in such programs?
Great question. Interestingly, yes. So even though it's only, say, 40% of the year that do the program, the benefits tend to reduce substance use rates across the whole year. And it's thought of that potentially is the herd effect, so that say that there might be less use overall, then that actually impacts on the other students as well. So there might be less people taking it up. So there's actually less opportunity for other students to use, or less peer pressure, all those kind of things. So it does tend to benefit the whole year, even though only, less than half of the year actually do the program.
And the last question, would it be suitable for outside school settings such as residential programs or youth programs such as the PCYC?
Yes, definitely. So it's not something that's been done in Australia so much yet, but definitely overseas it's been trialled in lots of different settings. It would just be kind of working out how best to facilitate that within the group, how to do the screening to be offered to as many people as possible, things like that. But definitely has been done and can be done and would be useful.
Thank you. I would like to thank Dr. Kelly again. Thank you, Dr. Kelly, for giving us your time and for the wonderful presentation you had for us today. If you want to learn more about Preventure or any of other Dr. Kelly's work, then you can follow her on Twitter. Her Twitter handle is on the screen. And before we sign off, I would like to remind our participants that we have a webinar coming up next week on the 25th of June. It will be based on cannabis use amongst adolescents. It will be a very interesting one, so I hope that you will register for it and hope that we will see you there. So thank you again from the Positive Choices team. If you have any questions or any comments for the Positive Choices team, please feel free to email us as info@positivechoices.org.au, and please don't forget to visit our website. You can see the URL on the screen. Thank you again, and I hope to see you all next week. Thank you. Thank you, Dr. Kelly.
Thank you. Thank you, everyone.